I'm Dr. David Thomas. I'm a practicing psychotherapist with the Whitford Thomas Group in Tampa, Florida, to discuss high anxiety symptoms. High anxiety, at least in my frame and my thinking, is an extreme form of anxiety. We tend to see that when we diagnose panic as well as anxiety attacks. So if we look at high anxiety being a more severe form of anxiety, you can kind of liken it to all your anxiety symptoms that oftentimes kind of come and go or kind of transient, tend to kind of emerge all at one time in the system. What are some of those symptoms? Well, certainly when we look at anxiety and we talk about fear, there's a rush, a kind of a hyper sensitivity in the system. Oftentimes what you see is the heart, the palpitations tend to be very fast, kind of a racing heart, racing ideas, skin moisture, tend to see a lot of tension in the head, muscle aches, stomach problems, restlessness, sleep disorders, a sense of doom, a sense of wanting to run, isolation, concentration issues and things of that sort as well. So when we have this kind of heightened or this kind of high anxiety symptoms, it's almost like all these symptoms kind of merge at one time in the system and produce a very severe or dramatic effect. Treatment-wise, it's pretty much the same, cognitive behavior psychotherapy with or without medications. At that time when you're experiencing a high level of anxiety, you probably want to learn different breathing techniques, relaxation techniques, so you can very quickly bring the symptoms down. With a little bit of work and help, you can certainly focus on the thinking that drives the anxiety, but without some prior training, it's kind of tough to focus on challenging and disputing the thinking at that time. We do that mainly in our practice with cognitive behavior psychotherapy. Well, I hope this information has been helpful regarding high anxiety. From Tampa, Florida, I'm Dr. David Thomas.